mic. Welcome on my channel, guys. I'm just here, just visit my friend. He's a physiotherapist at Adria Clinic. My guy, Tamim. I've known Tamim for like 5 years. He's my guy right here. Yeah, so he's gonna give me some treat, and we're gonna be asking him some questions as we guys gonna be here watching, and I hope you guys get to learn something. And you guys and guys in Dubai, trainers, guys that are training, so it's good to have some good recovery. And you can come around Adria. It's a very nice squad. Our clinic is very very professional, and you get to see Tamim here to kind of like do some work on you.
100%.
Make sure that you guys can be able to train for a long time. Yeah, so let's keep following and see how the guy does. Got some shoulder pains here, so it's gonna fix the stuff.
Let's work on Ibrahim today. So he came to the clinic complaining of some shoulder pain due to probably lifting a lot on his shoulders. So very big shoulders, wide, overtraining it probably. So a lot of probably overload to the tendons and muscles around the shoulder. So we're gonna give him a nice little release. Work a little bit on maintaining that sort of, and offload the shoulder a little bit.
Yeah,
Ibra, let's work on your stomach.
So I get to lay here?
Yeah, lie here, on your stomach.
This first,
Yes,
this way, yeah.
well, that way.
Okay, man.
We're gonna give you a nice.
So Dr. Tamim, what's the problem? What's exactly causing it? I need to know the cause, so as I can, and some advisors on shoulder injuries. Because a lot of people have shoulder injuries. You notice that most of the upper bodies.
Yeah.
So what advice do you give people?
I mean, I advise usually the most advice I would give people is do not overtrain. Make sure that you're progressively loading the shoulder. Because once you jump into to extra weights that your body is not kind of used to, we tend to see a lot of these what we so-called overload injuries.
Yeah.
That quite happens a lot with the shoulder, especially that it's a very mobile joint and it's easily injured because of its mobility.
Yeah.
So usually, yes, I would say resting in between the sessions of the training and make sure you're progressively loading it and not just jumping into like 50 kg on a shoulder press.
Yeah.
Just steady and slowly but surely getting there.
Okay. So I hope you guys understand what he means by progressive overload. Is increasing by the smallest weight over time. The smallest weight being most of the gyms will have like 1.25 or 2.25 gradually as you go on. So Dr. Tamim, I realize that most of the people that the most common shoulder injury is always like a rotator cuff. What advice would you give people to kind of like prevent it, and what is the quickest kind of fast relief in case it happens, and what do you advise them to do immediately?
I mean, the rotator cuff are always to be blamed with shoulder injuries, but we know now that it's not the case.
Yeah.
So it's not always shoulder pain is not always related to your rotator cuffs. It could be underlying causes behind your pain, like your bursa, your labrum, a lot of tissues around. So it's very kind of hard. Then that's why it's important to have a proper diagnosis of why you're having the pain in the first place. But generally, the advice as soon as people get injured is just to stop stretching and just rest it and let it settle for a few days, and probably consult someone who's a specialist to kind of understand what's happening and not just train over pain.
Okay.
That's my first concern, because a lot of people, when they get injured, they start stretching things, and that probably irritates.
That's on me. And I just keep training throughout the pain. Even though I'm a trainer, so even though I do encourage my clients to stop immediately, but to me myself, it's really kind of hard to stay away from it. So it's kind of like you're describing me. So funny.
I mean, usually, like, we've been always taught that, when you get injured, to stretch things, foam roll things, and poke things and stuff like that.
Yeah.
But now that we know that it probably irritates the tendons, irritates things around, so it's better off to just probably have something nice and chill, like just fresh juice or something, and just relaxing a little bit, taking it easy for the next 2 days.
Yeah.
Just monitor and see what's happening in terms of the pain levels, what's exactly happening. Is there swelling? Is there bruising? Is there any sort of discoloration on the skin? Just to kind of realize where we're at. And then obviously having someone to properly consult that can probably guide them into, for example, if they need a guided rehab program, or they just need to rest for a little bit and then start building things back up with the exercises. So yeah,
makes sense. Yeah, so I just kind of wanted to kind of like run through the viewers like what we're doing right here, because it feels the shoulder blades kind of feels relieved, and I noticed that you kind of like massaging around the shoulder blades, and it felt so stiff, but the more you're going on, I feel it's kind of loosening up. So what are we doing here?
So right now what we're doing is we're just doing some soft tissue release. So massage, we're releasing the muscles around the scapula, the upper back, your lower traps. We're just working on kind of massaging things just to a little bit loosen up things around. That will probably get you a little bit more mobility and give you a good relief for a couple of days, along with some other management that we're going to do that's probably going to takes a while, but obviously it will probably help you in the long run with your shoulder pain and your constant neck. So
would you call this an injury, or it's just kind of like just the not having proper recovery? It's just that muscles are stiff. Do you think it's an injury?
I mean, kind of curious. Depends how long has it been, right? So how long would you say you've been complaining about it? Right,
it's been a week, but I kind of feel like, to look back again, like it kind of feels like it's been building up. Because the stiffness started off from the pecs, and then all of a sudden I started feeling on a little bit around the scapula, and then the traps were so stiff, and then all of a sudden the deltoids were so stiff, and I couldn't almost lift up stuff. So it kind of like was building up gradually, and I wasn't realizing it.
I mean, I would, from the history taking, obviously, because it's like 60-70% of the actual realizing what's happening. I think it's more of a slight mechanical issue that can probably be fixed. I wouldn't classify it as being a real injury where like, you know, you gotta stop in for some time, you gotta take a week off, and then you gotta, you know, go through scans and go through all these things to know what's happening. So I think it's more like a mechanical thing, probably an overload, a little bit of some stress, a little bit of some work, and it should be fine. Like, but wouldn't classify it as a real injury, you know. So just something that probably needs some maintenance every now and then, especially with your sort of training, because you train a lot. So obviously you need to look after your body from time to time and just give it a little bit more release and stuff. And let me have you on your back.
On my back. Yeah. So actually, it feels so relieved, man. It's crazy. It feels super relieved, honestly. Yeah. Just wanted to ask you something now. As you know, viewers, I'm a personal trainer and help people get in shape and all that. But I do realize I do get this so many times that as soon as a person gets kind of like an injury, the doctors, let's say in your field, Doctor Tamim, they rush out quickly and be like, stop training, you should stop exercising for a while. And let's say someone has got an injury from, let's say, the shoulders, and then be like, you should now stop training, stop doing anything, and wait for recovery. What's your take on that? Do you think, for me personally, I'll just give you my personal view. I kind of like say you walk around it. Let's say you have a shoulder. It's upper body. So, I mean, like you could still carry on with your journey and you kind of like walk around it. So probably focus on the lower body and all that. But the doctors always rush out to say that, you should immediately stop exercising, blah, blah, blah. What's your take on that?
I mean, lots of doctors don't exercise themselves. So it's kind of, you can't really go to a doctor that does not exercise and tells you not to exercise. I mean, it doesn't work that way. I mean, if your doctor doesn't exercise, probably don't go to him. That's my take. That's like the one thing I would look up for. Like, I'll make sure that my doctor is exercising himself, because if your doctor tells you to stop training, I think you should just probably run away and probably come see me instead. Because yes, like you said, Ibrahim, like you always work around pain and you always try to find a solution, but stopping training is not a solution. Like I get a lot of times where people are injured and they're not able, for example, to move their hand. But I always tell them that you can get on a cycle and you can start cycling because that will speeden up the process anyway.
Exactly, that's the logical thing I think of, you know?
Yeah, so rarely, seldom do I actually stop my patients from actually exercising. And if I actually do that, it's probably for 2 days or 3 max, but not more. So you can get away with 2-3 days of rest, but I don't think more than that is ideal for any sort of condition.
Okay, so in other words, what Dr. Tamim is trying to say is don't take advices from doctors who don't train themselves about advices of training. So, okay, that's really clear. Makes a lot of sense. And also, I've realized that because I've worked with so many people, quite like 90% of the population in Dubai, they do have lower back pain. So what do you think is the cause of that? And what advices do you give them? What kind of general advice do you give them? And also, what sort of habits do you think they should take on?
My number one advice is deadlifts. I think people should deadlift more often. I think there's a lot of
people, when you said deadlift, they're like, oh, I have a back pain. Then if I deadlift, it's gonna be worse. It's gonna get worse because deadlift is very. So what do you say about that?
Exactly.
So what would you tell that kind of a person?
So deadlift is a functional exercise because, for example, you'd literally bend yourself and grab groceries off the floor. So it's the same thing. Why would, for example, grabbing your shopper bags off the floor not be dangerous, but lifting weights is dangerous? I don't see the logic. So it's a functional exercise, and I think your spine is made and built to be bent. And God has gifted us a spine that moves in different directions, such as forward bending, extension, side bending, all these movements. It's just more of like moving in these directions that's going to help us more than actually being stiff and just using the machines all the time, you know? Just letting our body to move freely. And just the fear of all the personal trainers that they created about deadlifts and how it just gets people injured. Just the whole fear about it makes it actually conscious, and it actually can probably be a bit harmful. So I would say getting to understand it is crucial.
Actually, you spoke about groceries. It kind of reminded me of one of my clients that I work with. She was all right, and it's so funny. She got injured picking up something so small, which is not heavy, and she got a very, very bad back injury from just picking up stuff. So I just want to ask. I just wanted you to give them some advice, like what would be the right way to pick up stuff, because you kind of realize that any injury can happen at any time. It does not necessarily mean that you have to lift up something heavy. It can just happen. It can be something as minor as picking up something like a pen, but you pick it in the wrong way, and you know.
Yeah, I mean, there are a lot of ways that people kind of emphasize on in proper technique and in terms of lifting stuff off the ground. Like people say, oh, you should bend your legs, you should not bend your back. I think it doesn't have anything to do with it. Like an injury, especially lower back injuries, how they occur is we don't exactly know why. We have no idea why it happens. Like it could be you lifting 210 kg, but it could be also you lifting 50 kg, and you can get injured. So there are a lot of factors that are
associated with
that. A lot of factors. So sleep, stress, work-related, long hours of sitting, not really exercising. Also, genetics plays a huge role in these things. So the number one reason is not yet revealed, but I would say just simply empowering patients to move more and or clients to move more and be able to sort of get over that fear of bending their backs more often would probably work in their favor.
Okay. So I do realize that I think that's the cause. I wanted us to look at the cause, because it's so hard to fix something without knowing the root cause. Where is it coming from? What do you think is the number one cause of people, particularly in Dubai? Because I'm originally from Uganda. Like in my country, bro, I've never really heard of people having so many back pain issues. As here, it's kind of like every person that you meet has got a back issue, which you rarely find in a country, let's say like in Uganda. So, what do you think is the cause? Is the cause of that? And just
One of the most important ones is sedentary lifestyle. People sitting for long hours at office, and stressful jobs, and I would say mostly that's my concern. People don't really move a lot. Everything's over the phone. You just order whatever you want.
That's kind of like the Dubai kind of lifestyle. Exactly. Everything you could just literally be in your room and everything finds you there.
Exactly.
If you want.
Exactly. You can just order anything you want in like.
That
You'll
makes
be
sense.
at your place in like 20 minutes,
That makes sense.
And people driving their cars, obviously, due to the weather being just super humid, especially now in the summer.
Yeah.
So people are just being more lazy, I think. Not a lot of movement. But I think it's slowly starting to pick up a little bit. People are becoming more aware of the problem and the hope in there. Because it is disabling. Like in the US, it is actually disabling, like cases of lower back pain. And if you compare it to people actually not going to their work and their jobs every day, it actually affects a lot of people. So,
Wow. All right, man. I like we were talking about that exact thing, and like in Dubai, like people move like for someone to make like 6,000 steps, they feel as if it's a
accomplishment.
It's a big accomplishment.
It's a big accomplishment,
it makes sense what you're saying.
I make 10,000 steps just in office. So 10,000 steps is not something.
Nothing.
I mean, if you're one of people watching, you do 10,000 steps. I salute you. Like that's way better than people who are not doing anything.
Exactly.
So that's good. Way to start. It's a good start point, yes. But I would encourage you to probably start strengthening more, doing your mobility stuff, sleeping more often. I mean, I cannot emphasize on the importance of sleep. Sleep is more important than, for me, I believe sleep is the most important remedy ever. Like it's more important than massage, it's more important than your doctor.
But now you see, talking about sleep, I just kind of reminded me of Steve Harvey. Yeah, just he was saying that a normal person should sleep like 4 hours because the stock market opens up this, and so we kind of like living in a country, in a world of mixed feeling. At the same time, people are so desperate to be successful. At the same time, on the expense of health, and then on the other side, the doctors are saying this. So the right balance is kind of like difficult. So it makes the whole thing difficult,
Yeah, I mean it's all about your mental health and like sort of like the way you prioritize things. Like for me, example, I wouldn't wake up for the stock market to open. I would probably make sure I get 8 hours of sleep, 7 to 8 hours of sleep due to my hyperactivity. I'm just gonna use a shockwave now. So what this machine actually does is it sort of like if you have an irritation towards the tendon where it keeps on the percussion, and it kind of helps decrease the sensitivity of pain in that area, much as it also sorts of increases the blood flow to the area. So sometimes in particular areas, especially with tendons, muscles where they're a little bit irritated due to, for example, an overload, this kind of helps alleviate the pain.
Okay.
So it's going to be a little bit painful. We're going to take a little bit pause from talking to our viewers.
Yeah, sure. Let's get to that.
Okay, you ready?
Yeah, let's go, my man. Wow, I'm curious, man.
Okay. Okay.
It dictates where the pain is, huh?
No, so this is usually I use it for like sometimes when there's an irritation towards some tendons and the body. With these like pulses, sort of directed towards the area of pain. It kind of desensitizes the area a little bit. So for athletes, a lot of times they feel these niggles around their shoulders because of the training. So this kind of helps them sort of relaxes the area around it and just alleviates the pain to allow them to kind of continue their training programs and just
Feels great, man.
I mean, it was very painful, I'm pretty sure. So
It was painful,
so that's what we call
but
a
I think I
shockwave.
got used to it at some point. Yeah.
So that's what we call a shockwave
Yeah.
treatment. Works best on muscles
Definitely,
and
my
tendons.
shoulder is really. Is it a what's this? Is it a massage?
So this is mobilizations. There's something called mobilizations. What we use this technique to kind of sort of mobilize the spine around the neck. So
it feels very strange, but so nice again.
yeah. So again, it's like it's moving your spine in motions that it hasn't been moved for ages.
Yeah. Because you really do this.
Yeah, we really do this. We really move our neck a lot, and when you don't move something for some time, it gets a little bit stiff.
Yeah.
So that's why doing your neck exercises from time to time, especially for people that are suffering neck pain, there are lots of exercises that I can show that need to be focused on.
Really? A lot of people don't think that the neck needs to be exercised.
Yeah, a lot of people don't exercise the neck, but until they come to me, then they realize that there are actual exercises to the neck.
Wow. I do think that it's necessary, especially in the lifestyle that in this generation that we're living in, all the time on phone, computer, work, all the time. So I think it gets super stiff.
Of course, long hours of sitting.
Yeah.
Just in a certain motion. Even like, for example, cyclists who are always in that sort of flexion movement for long hours, they always complain of neck pain. So make sure you exercise your neck just like you exercise your biceps.
So for those of you that are looking at getting those exercises, I'll put the social media handle of Dr. Tamim probably. If you're interested in knowing how you can work on your neck and do some light exercises, I'll put the link there, and then you guys can reach him out and get to know more about Adria Hospital and Dr. Tamim himself. You guys get to interact with him personally.
Yeah, I mean, my Instagram is usually up to anyone want to ask me a question.
Great.
The other day, someone came in my direct and he was just talking about his ankle, like, what should I do? So I gave him an honest reply. Like, I didn't even say thank you, but okay, like, it doesn't matter. I mean, like, I'm pretty much free to answer whenever I can. So feel free to message me on my Instagram, whatever, if there's any concern. Yes. If there's any need for me to consult with you, then probably yes, I would advise you to come to the clinic. To get things checked. Always better than an online consultation.
Yeah. Some people, like, I had a guy sometime back, we worked together. If you do reach him out on social and then you ask him some question, it will be like, hey, you want free things?
Yeah.
100%. So yeah, I like the fact that you approachable and you're trying to give back to people, because that's another way of giving back. Just a few seconds of a reply really doesn't cost much. I mean, but a lot of people, we're in a world whereby everybody needs to be given something to give back.
Exactly, 100%.
Which is crazy.
Okay. Now what I'm gonna do is I'm gonna do some manipulations, just kind of improve a little bit the motion of the neck. So if you relax completely and take a deep breath in for me.
Yeah.
Take a deep breath in. Out.
Oh shit. Oh shit. Oh shit.
Okay, good.
That was crazy. Oh damn. You spoke about the ankle. Do you know that the other day, I think it's been like 1 month back, I was just literally walking. No more walking.
Yeah.
I screwed up my ankle. Up to now, it's never recovered. I don't know what
you
happened.
Twisted it.
Not twisting. just walking normally. I had something, and it's never gone. I don't know what happened. It's strange, and that's really frustrating because I realized that most of the injuries I've never got them while training.
Yeah.
I do get them when I'm doing like normal stuff,
Yeah, exactly.
which is really
so
for
funny.
me. It's kind of
It's so
out.
funny.
I don't even know whether it's this outside. It's disappointing
It's so funny, yeah.
because you expect that when you exercising is when you're gonna get this sort of stuff.
Okay, what we're gonna do is your upper back adjustment. So take a deep breath in for me and exhale.
Oh God.
Okay, good.
Wow. What was that? That feels great
A
though.
lot of tension around your back, so we kind of just
God.
some manipulations to crack things up.
Wow.
Just to kind of gives it a little bit of a relief.
Oh my God.
Now I want you to be lying on your right side.
On my right side, right here like this?
Yeah.
Oh my God, that feels relieved, man.
Okay.
Like
Keep your leg here,
this one
man.
here.
Very good. Keep your legs there.
Okay.
And just bring it back. Very good. I want you to take a deep breath in for me. Out. Exhale.
Oh my God. Oh my God. Oh my God. Oh my God. Oh my God.
Okay, let's go on the other side.
What was that? Oh my
It's a
God.
lot of cracks, huh?
Oh my God. Oh my God. That's so scary.
Okay.
And nice at the same time. Oh my
Yeah, it
God.
is scary if it's probably done the first time.
Yeah.
So.
Oh my God. I can't believe it. Oh my God. It's actually real. I've been sick.
Take a deep breath again. Out. Exhale.
Oh my God. Oh.
That's good. That's good.
Oh my God. Oh my God. But it feels so good afterwards. Oh my God. It's actually real, you know. I've been seeing people doing this and I'm like, is that real? Oh my God. You guys don't know how I feel right now. It's kind of like,
all right, that's good. That's
oh
good.
My God.
Now I'm just gonna show you one or two exercises that can probably
help out on
a thing. Yes, obviously, 100%.
Wow.
Once you relax.
Wow. That was crazy. Oh my God. Ooh, but you know, I feel really great, honestly. It feels, I can't describe the feeling honestly, but it feels like, you know, like when you have something inside the back, like you've been lifting something heavy.
Yeah.
But when you get done with those, I don't even know what the hell is that cracking.
So we call it chiro adjustments. Yeah, they call it chiro adjustments. Chiropractor adjustments.
Yeah.
Mostly call it that, but it's just called manipulations or what they call it adjustments. But it's just kind of like you said, there's a lot of tension around the spine, and what that helps is just kind of gas particles leaving that sort of joints in between the spaces, and that's why he feels that sort of relief. It's quite good, but obviously not overdo it. But I think it's good along with the exercise.
With the exercises,
it will get you far.
So, how often would you recommend athletes to do that? Because honestly, I feel light. I feel weird. I can't explain the feeling, but I feel light. It feels like I've been having some stuff in there.
Yeah.
But now I feel like I'm loose. You know. So that sort of feeling. It's very weird feeling to explain.
Yeah, it's very subjective. So it depends on the patient, depends on the client that we're getting, and the reason why we're doing that. Right? If we're doing it to an athlete to kind of like give them that sort of relief, I see absolutely is fine. But if we're giving it to people as a sort of just a treatment for their back pain, I don't think it works that way. And it's just a tool that we use along with other things to kind of empower the patient and be able to get them back to exercising and doing their daily meaningful lifestyle activities that they were not able to do because of, for example, back pain. So it's a tool that we use, I would say, but it's not the number one intervention for things like that. But yes, like we said, it feels really good. It helps you with lots of things, but it's just the reason and the goal behind doing these things is the most important, I believe. So it's very subjective. Some people come in every week, every 2 weeks for it. Some people come in every 3 months. Some people want it every day, but
every day. I think that's way too much. Obviously, I do understand.
My colleague wants it every day, so my colleague comes in every day just to get it. So I give it to her because she's very active and she's sporty and she does a lot of running and a lot of weightlifting. So I think that's fine. But to patients, I wouldn't suggest doing it every day.
Yeah, too. Okay, so I do understand why they want to do it every day.
Yeah.
Because obviously going through it is kind of uncomfortable.
Exercises to my patients, I
Yeah.
usually give them 1 or 2 max, but I usually do 1 because I know a lot of physios probably prescribe like hundreds of exercises for our patients, and the patient does end up doing nothing.
Exactly.
So I'm pretty much straight with 1 exercise being done consistently is way better than like probably 5 or 5 being not done.
Makes sense.
Especially that our patients are probably not having the time to spend on themselves doing exercises. So one of the main best exercises I would say for the shoulder, especially with shoulder injuries and shoulder pain, is a very simple exercise, which is a lateral raise. And what we used to do with the lateral raise is we usually hold on to this angle here, which is a 90 degrees angle. But my sort of lateral raise would be a full range of motion lateral raise, and then slowing down as
on the eccentrics, on the negatives.
Exactly. So going all the way up, and then slowing down. And what's that going to build is that going to be able to build that sort of muscle endurance throughout the whole range of motion.
Yeah.
When in fact you just do it here, you're just missing out on a lot of range here and not really strengthening that shoulder in it. So I would say a full range lateral raise is one of my top and favorite exercises that I prescribe because it activates the whole rotator cuff and every and each muscle and tendon around the shoulder. So give it a try.
So you don't advise like I'll say like the bodybuilding kind of way. This one where they stop here.
I mean, it depends, right? So I would say bodybuilders usually try to control the angle to have more tension around certain area.
Yeah.
But I would say for the general population or people who are even athletic that want to train their shoulders, I say they should work throughout the whole range of motion. It's just to keep more mobility around the shoulder, because a lot of times if you're working half range of motion, you're just losing a lot of mobility around that shoulder. So I would say any exercises generally working in that full range is going to benefit you 100 times more than half the range. And try it out for yourself.
And how hard can one go?
How hard?
Yeah, because we realize with a band.
So with a band is much easier, and that's what we say. So when you come out of shoulder pain or shoulder injury, what we do is we usually minimize the resistance and start off building up slowly. So I would say if you start off with 2 kg or 3 kg for the first week, then the second week you kind of top it up a little bit. So I would say generally starting with the lowest, which is like probably 2-3 kg, and then it's kind of building on top. But again, you got to pick it up subjectively depending on the patient.
So even with the dumbbell, you will be doing the same kind of thing?
Exactly, yes. So even with the dumbbell, I'd probably be working out on the
full range. Okay.
Because what we're doing is we're not activating certain muscles here, we're activating the whole shoulder.
The whole shoulder.
So the whole shoulder is being activated right now.
It actually feels good. I mean, you can feel a certain area where a little bit of a kind of like a pain, but then you feel that over the more you do it, the more it's kind of like getting stronger and getting comfortable.
Exactly.
And I also feel the lats as well kind of like starting to burn a little bit the more I'm doing it. And also I can feel the front deltoids, probably because it's more stiff. But overall, the more I do it, I feel really better.
And that's it. That's one of the top exercises for shoulder pain.
Great, man. Great. It's been Dr. Tamim and me, Kat.
Call me a physio. I'm just a physiotherapist.
Great having you, man. I feel really great. Obviously, I feel like I can go in the gym right now and start banging it, but I'm gonna behave and I'm gonna focus on the lower body just to give it some time. Let the treatment sink in.
Stuff calm down and build things back up. And we take things from there.
Thank you so much for sharing with my people the information. It's been generous of you. And you guys, let me know if you want to hear more of what Dr. Tamim has prescribed, and you guys hope the information kind of helps you out. For those of you living in Dubai, and let's say you're not even in Dubai, your athlete is out there, and you wanna get services of Dr. Tamim, I'll put his Instagram handle down there, and also you can find him at Jumeirah Adria Clinic. You guys come through. He's a very wonderful guy. Obviously, he's helped fix my shoulder. I feel really great. I just can't wait to get back to my lifting of upper body's been down. So hopefully I can get to see him more often. And if you guys find this information helpful, let me know down the comment, and I can always get him on and on, so as you get to learn more and more. And you guys come down and get to speak to the man himself, man. You know, yeah.
Come out. I got all the time.
Yeah, you're always here
For now.
Thank you so much, my man.
Pleasure having you.
So it's a pleasure.